So now we're going to talk about a facelift procedure. Now some people use the term complete facelift. I really refer to a facelift procedure affecting the lower third of the face and the neck. Usually we include a neck lift with a facelift procedure. So a youthful face is like in A in this slide, and you have a discrete sharp angle between the mandible and the neck. And yet as we age, we begin to show changes, as in B, the early changes. You see a little bit of the nasolabial fold. You see a little bit of the marionette line. She's getting some crinkling in the neck, a little bit of banding. This progresses to C, and of course gets even worse in D. And by the time you get to D, you have these deep, dense jowls, and you have all this sagging in the neck that we refer to as a turkey gobbler neck. So, so the facelift, the way I use the term, refers to the lower face, and it is not just a procedure for females. Men have this procedure done as well, and people who want a facelift come in all age groups, obviously different genders. Here's a gentleman who was still working. He felt that his appearance put him at a disadvantage to compete with other men that he was competing with, and that's why he had the procedure done. And as I said, people come in different genders, but they also come in different age groups. So this lady is only 51 years old, and she's a good example of people ask me all the time, how long does it take to heal from any procedure? And the answer is that there's no short answer to that, because healing is a process. So this lady is only at 9 days after surgery, and she had upper and lower eyelids done, and she had a lower facelift done. And she is wearing her hair over the incisions. So the incisions are made in front and behind the ear. But at 9 days, she had absolutely no bruising in her neck or in her jawline. And the only clue that this lady had surgery 9 days ago is that she has a little bruise in her left lower eyelid, which I'm going to show pictures of that later. So healing is a process. It depends on people's general health. It depends on gender. It depends on blood pressure. It depends on whether you're taking vitamins or anticoagulants. Last patient was 51. This patient was only 44. And she was unhappy with the jowl, and she was unhappy with the banding in the neck, and so she wanted to have something done. So some people might ask me, what is the right age to have something like this done? And the answer is there's no short answer to that. There's no problem doing something if you're in your 30s or in your 40s, because you get a lot of years of enjoyment out of it. And if it bothers you and you want to have it done, I see no reason why not. Likewise, for the older patient, if patient's 70s, if patient's 80s, and they want to do something to improve their appearance, then why shouldn't they, as long as they're healthy enough to have the procedure? Again, this patient's in her late 60s, I would say, and you can see what an improvement she's had to her face and to her neck as a result of having a lifting procedure. And this has taken many, many years off of her appearance. She was extremely happy, and it's a good example of what can be achieved with surgery. Patient in the 50s, you can see the early banding in the neck and how much better she looks after the procedure. And another patient in the 50s. And you know, this particular patient was extremely pleased with her appearance. I would say that she lost at least 10 or 15 years. People would say she was about 10 or 15 years younger than her age for having this procedure done. So she was an extremely happy person. It was very gratifying to me to take care of. And I think that's why I do what I do, and it's why I enjoy doing what I do. This is a patient that I think was 54. You may look at her and decide she really doesn't need anything done. And that's fine, but she thought that she needed something done. So she has a little bit of banding in the neck, a little bit of jowls, and so we tightened that up for her, and her jawline and her neck are almost like that of a 20-year-old. And so we like to say that they're almost smooth as a baby's bottom. And she was extremely happy with that result. So that's discussing the different ways we restore the proportion of the aging face to a more youthful proportion, the 1:1:1 that we discussed earlier.